We're joined here today with autism advocate Marcia Roth. And Marcia, could you tell us a little bit about your professional background?
I have a background in public administration. I worked in state government for over 35 years. And I also have a law degree because I got tired of having people tell me what the law was and then only finding out that they were incorrect. They had not told me what was true.
Marcia, do you feel that New York State has an obligation to fund and fight the autism epidemic with public monies?
New York State clearly does. If you look at the New York State Constitution, the article that's concerned with finances, you will find that there is a clear statement that New York State can use its funds to give to individuals to deal with mental retardation and other related issues. Clearly, New York State does have a mandated responsibility as per the state constitution. And it's important to realize that that state constitution section was written in 1938 when this country was in the worst of the Depression, a horror that we are only beginning to reach. And it's extremely significant that the people in New York State who had a lower standard of living at that time still came together in a state convention and said, we're going to meet that need and we're going to spend state money to do it, and they put that in the state finance section. So yes, New York State does have a very clear role in fighting the autism epidemic and in doing it as best it can.
The Mind Institute out in California conducted a very detailed epidemiology study showing that the rates were increasing. Can you speak to some of that and what it really means to New York and how budgets are going to be strained in the coming years when most of these kids start aging out of the system and require adult care and other services?
Well, this is very key. In New York, there's unfortunately been a lot of denial about the extent of the autism epidemic and the fact that it actually is increasing and that it exists. California is a state that's comparable to New York. When you do any kind of fiscal study and you look at what other states are doing, you always look at what California is doing because they are so similar to New York State and their policies have been very similar to New York State. Unfortunately, what the California study uncovered, and interestingly enough, California used all of the people that are being served as their population database for doing the study. What California found and what New York State is finding now through its experience is that the autism epidemic is getting worse. They were finding more and more children at younger and younger ages are being diagnosed with autism. And as they found in California, it doesn't matter if you change the definition of autism, if you try to make the eligibility for services more restrictive, the numbers keep growing and growing. And you cannot deny that there are people out there who need services, and you cannot deny that these people are going to live to grow up. So the quality of education they receive in turn determines the level of services that they're going to need as adults. Here in New York State, we are lagging behind because the education system is operating under one standard of care and one standard of services for individuals, and the OMRDD system is working under another system of care, unfortunately based on the past institutional practices, instead of what the community standards are and what the standards are that families are setting. It's critical in New York State that we have one uniform system of standards at the appropriate level so that individuals don't suddenly find a drop-off in their standard of care when they leave the educational system. This is one significant problem we're facing now. And the other problem, of course, is financing all of this. Families that are paying for their children's medical needs who have autism when they're younger suddenly find their children as they become adults are off their insurance policies, and all of a sudden the medicine that they're taking that enables them to go to school, study, and work is no longer affordable because now they suddenly have to pay for it themselves. And if they don't have health insurance, then they're in a very serious position. We need to have the insurance industry step forward and step up and meet the need that's out there right now and create something that's affordable.
Do you think the state, under the Constitution, has an obligation to partner with the insurance industry to help defer some of the costs that will likely escalate in the short term until we start addressing the medical needs and the medical management of these kids?
Well, part of the problem in meeting the needs is in defining what needs you're going to meet. If you take we have to meet all needs, whether the person needs that need met or not, approach, of course you're going to just raise the cost of providing services. However, if you take the approach that they're taking over in England now, where they're saying, first of all, nobody is totally incompetent, nobody doesn't have areas of strength. We want to know what your areas of weakness are, and we're going to provide services to meet those areas of weaknesses. because you're competent in other ways. And we don't need to do that for you. We're not going to come in and act like Big Brother. So I think that, first of all, one of the things we really need to do is take a hard look at what actually the needs are for services. People with autism have splintered abilities, and that means that they don't need to have 100% of their needs met by the state or by insurance plans. They only need to have that portion where they have an identified weakness and an identified need for help in meeting a daily life situation.
Do you feel that we have really just avoided the medical management of these kids, being that autism is defined as a neurobiological condition and not a psychiatric condition?
Well, the problem is not whether it's identified as a neurobiological or psychiatric condition. The problem is that we don't have adequate information management programs set up and techniques set up now. Yes, this is a very diverse population. That means that the information needs are much more broad and also more detailed than in the past. But guess what, folks? We have computers. We have very sophisticated programs out now that we can apply to identify the information that's needed and then key it to an individual's needs and then create a unique file and a unique information set that can then be determined, used as a basis to determine the needs of an individual and what services they should be applying. So again, I think that the biomedical psychiatric debate, clearly this is a biomedical neurological condition. So that debate to some extent is just a way to deter people from taking action now. And we really need to walk away from that and say, it's over, it's done. And we need to develop the information skills and the information management skills to actually create a service system that's needed.
We know this is a biological, biomedical condition, yet our health department has not stepped up, they've not engaged. Do you feel that they're going to have to finance some of these epidemiology studies? For instance, our state health department still considers sensory integration to be experimental, even though it's done with almost all of the young children at schools today.
I think this is really a key question to ask, and the state health commissioner, I think, has a lot of explaining to do why he hasn't been active. One of the explanations that he could give is to say, well, we have given the OMRDD responsibility for the Medicaid waiver program, and therefore OMRDD through the Medicaid waiver program is really dealing with the autism epidemic, not the health department. However, what's becoming clear through the study in California is that we do need to have a very hard, well-done epidemiological study of what's happening in New York State, so we can identify if there are hotspots of autism, so we can identify possible environmental causes of autism, so that we can find out specifically what might be causing the autism epidemic and why it affects people in so many varied ways. This is a critical health need. The education commissioner, the health department commissioner needs to sit down with the education commissioner, and he needs to sit down with the OMRDD commissioner and say, look, we're going to step up to the bat now. We're going to do our part of the epidemiological study. I want to get your data. I want to find out what you know about the population with autism in the state and start the effort to do so.
Do you feel that there's a disconnect between state agencies wanting to give up that money and allocate it where it really needs to go to help these kids lead productive lives and keep this from bankrupting the state, quite frankly?
You're right on. Quite clearly, countries with lower standards of living and lower fiscal resources have adopted a person-based system of delivering services that's more cost-effective and that often is more effective because it's delivered in sight. There's a concept called Wraparound Services, and under the concept of Wraparound Services, services are defined and delivered directly to the person, and they follow the person no matter where the person goes. In autism, we have a lot of people with very highly individualized and differentiated needs. So you can't take a cookie-cutter approach. And taking a cookie-cutter approach means that you're spending money on things you shouldn't be spending money on. And I think it's also very clear that there is a very small group of people with autism who have significant behavior problems and significant problems. And they need a very intensive, lifelong system of positive supports. Everyone in the autistic spectrum needs positive supports, but this very small minority of individuals needs it more than other people do. There is no fiscal or rational basis to deny people wraparound services. It's been around for a long time. We know that it works, and we know that it's cost effective. Simply putting somebody in an institution and trying to provide all their needs makes no sense whatsoever, when half those needs they don't need to be met. Some studies have shown that 50% of people in institutional settings do not need to be there. That's 50% of the cost that we could save and that we could spend more effectively at home in the community, at the family and individual level. Individuals know what they need, and they should have the right to say, I can do that. I don't need you to spend money. I don't need you to spend public money on that service for me. I can take care of myself there. And we need to respect individuals and take that approach.
That's great. Thank you very much.